Okay, so thank you guys for coming today. It's kind of really exciting because there's less of us. I know a few people signed up. I don't know if they'll come in and out, but it's very close knit. So make sure like you ask the questions. So a bit about me. I started a company called Pharmaspire because I essentially tutor pharmacy students and A-level students and GCSE students. And when I started doing pharmacy, there's like nothing out there for it. There's the way that there is for med, basically. So if you go on like med websites, there's like all this stuff about the UCAT and interviews, but there's nothing out there for pharmacy interviews. So I kind of wanted to make like a platform that had everything that you essentially would ever need. So like I always kind of take on you guys' feedback, and one of the things that you guys asked for was a webinar. So I essentially have kind of gone through and made a nutshell of everything that you need to know, but I want this to be really chilled and relaxed. So if you have any questions, essentially just like put them through the chat. A bit about me as well in terms of like my interview experience. So I've been doing mock MMIs for the past 2 years. I'm kind of like higher up in like, because I'm fourth year in Kingston, I do kind of like talk to those who run the pharmacy interviews and help kind of like when I can, essentially, if they're running low on staff for the pharmacy interviews. So I've kind of have a bit of experience in like what you guys need to know. And then, yeah, so I've kind of been there, done that, and spoke to loads of students that have applied to different pharmacy schools. So I kind of know what they ask. So let's go on with it. So with that, today we're going to go through like what are their interviews looking at, because I wanted to really go through this because one of the main things that students get really scared about is that they come out the interview and they're like, oh my God, I didn't know the answer. But it's the way that you say it. So if you say the right buzzwords and you say the things that the interviews are looking for, then you can kind of get away with it. So it's all about, like with me, yes, you need to get things right, but let's talk about being realistic. Like you're nervous, you get nervous on the spot and you can go blank. So let's see how you can overcome that. Why pharmacy? I think it's really important. Why this university? The GPHC standards I'll talk about a bit. And then the STAR method, the role of the pharmacist, because there's some things that you need to understand the role of the pharmacist to make sure that you have really good answers. A bit about wider reading, math questions and scenarios, a bit of brief, but I've kind of like gone through many things like what to do if you're in a group interview, what to do if they give you an article for an interview. So we'll go through things like that. So again, if you have any questions, like shout it out. So essentially what they expect in the pharmacy interview is you need to make sure that with every single scenario that you have, that you start to put patients, like you have patient-centered care. Because I know one girl that kind of didn't get into, like kind of got rejected from a pharmacy interview, and I kind of asked her, like, can you email to get feedback? Because she was asking me, why would you think why? And I was like, I don't know. And one of the things that she got told was essentially that she didn't tie in any of her responses into patient-centered care, empathy. So like make sure you kind of like put that at the center of your answers. They really like patient-centered care, and it doesn't really change because like as you go through pharmacy school, you have to do like SJT exams, and that is still the case. So they like things like that. You need to understand the role of the pharmacist, and I thought I'd go through this because there's a lot of like uncertainty because of the new IP course as well. So we will go through that. So they want you to understand like the general cause of it. They want to see if your professionalism is really important in pharmacy school. You'll have like when you get into first year, it's like the first lecture you have. So they really want to make sure that you have a good like pros and cons. You're like very like open-minded. You're very professional with how you word things. You got clear communication, your ability to reflect and learn, and safe decision making. Yes, in some questions this is not apparent, but I always say like to keep this in the center of your mind when you're dealing with ethical scenarios. If you don't know the answer to ethical scenarios, it's fine. As long as you keep these core fundamentals throughout your answering, you should be fine. So that's kind of a bit of a nutshell of what they're looking for. So every single pharmacy interview, well, majority of them ask why pharmacy. They could word it a bit differently. It's either why pharmacy, or a lot of the time they like to suss out who are med, like who wants to do med and who wants to do dent, because that's kind of like expected, right? So they could say, why pharmacy and not medicine? Why pharmacy, not dentistry? Or why pharmacy and not like nursing? That's the common one. So you need to make sure that you are prepared to answer this question, right? Because you need to be very, very exact. Because if you're saying like, I want to be a pharmacist because I want to help patients, well, that's the same for like medicine and nursing. So you need to be really specific on like why. So like my go-to arguments are to be really direct and critical, talk about how pharmacy is like a really like a career with so many options. It's got a lot of breadth to it. Talk about like you've got a particular interest in treatments and like patient care, lifelong learning, because we have to constantly read on the BNF and things like that. So you like research, that's a really good one. The role of the pharmacist beyond the dispensary, how it's very like expanding. You could talk about the impact on public health. So when we have to kind of like be the forefront of the community, more so than doctors and nurses. Maybe working in a multidisciplinary team, and then the responsibilities and trust in the profession. So make sure you're kind of linking everything together. So obviously I can tell you how to answer the question, but obviously like I think it's different when you see it for yourself. So I've kind of put like a mini model answer. I thought it would be a bit helpful, and like kind of how a structure that you could kind of rob essentially. So eventually, if they say why pharmacy, you can say this. So I'm drawn to pharmacy because it sits at the intersection of science and patient care. So I'm always been interested in how medicines work, especially how they're used to manage long-term conditions like asthma and hypertension. Things like that is really important because you're showing your wider reading as well. So you read on the fact that pharmacists help with long-term conditions and minor ailments, and you're getting your buzzwords in there. So I always say like kind of like show off, but don't say things that you don't know much about because they can ask you like as a prompt question. So you can say, after research in the pharmacy first scheme and independent prescribing, I became excited about the idea of being more involved in clinical decisions and patient outcomes. So you've acknowledged like the new degree and the evolving role of pharmacists, especially in community and primary care, inspired me to pursue this path where I can use my knowledge to directly improve lives. So you can literally say something like that. It's a bit robotic, but add a bit of a twist onto it, add a bit of empathy on it. Like, what did you do, like work experience? Talk about it there. Did you, like, a lot of you work in care homes, for example, so talk about how like you saw the nurse and like the obstacles they did when trying to give the patient medication. Like in care homes, a lot of the time we may have to hide the medications and stuff, like concealed delivery. So think about how it kind of relates to your everyday life, because they could ask you on it. So my kind of core structure for you guys is talk about where did the interest begin, so your past. Talk about present, so what have you done to explore the pharmacy degree? Did you do research? Did you do work experience? And what you hope to achieve as a pharmacist. So why do you want to do pharmacy, and what do you hope to do? Do you want to be a pharmacist to kind of be more on the front line? Do you want to be a pharmacist to go more into research? Those are kind of like a good baseline when kind of dealing with things like that. Does anyone have any questions so far about why pharmacy? No? You can rob the model answer, I don't mind as well. So, right, the other thing they like to ask is why university. I think this is a bit more trickier because essentially, like, what you're picking them university a lot of the time because it's either closer to home or it's renowned, right? When it comes to a whole closer to home topic, you can actually say it, but the way that you say it is really important. Like one of my students said, like, honestly, I just picked this pharmacy school because I don't want to move out. Don't say it like that. You can say like, oh, I know that pharmacy is a very, very difficult degree. And one of the things that I need to do when managing my stress is that I rely on my family a lot and I value family support. So obviously, when picking this university, it's closer to me and to my home. And I feel like being in this university will help me with my support system. So kind of word it like that, where you're acknowledging the intensity of the degree. And then Also, but then when you say that, it needs to be like, oh, I like this university because even though I'm going to stay at home, they've got loads of pharmacy societies and like societies, and the university life is very good. So you kind of have to word it like that. So you can say it's because I kind of like live close to home. So things like what you're looking for when they say why this university. You need to talk about course specific reasons, not location only. So if you say location, say other things as well. Do they have evidence-based learning? Do they have like really good labs? Do they do interprofessional learning? Like, for example, I go to Kingston and we do a joint course with St. George's. So a lot of the time we would do interprofessional learning with the med students at St. George's, and whenever our teachers didn't feel comfortable at teaching something at Kingston, a lot of the time they would put us with the med students there, and it was really interesting. So you could say like that. You can say the teaching style and support. Some unis kind of like teach based on semester, and some unis teach like one module throughout the whole year. Is that what you prefer? And like patient focus and clinical exposure. So some unis actually kind of offer industry placements, some unis don't. So you can say like that's one of the things that you want to do, and then how it fits to you. So like, why do you think that you suit that university? Because obviously you're a high achiever, or talk about the research facility. So that's kind of like what you're going into when it talks about why university. But yeah, you can get most of this information on the website, the pharmacy website, the course website. Okay, so let's talk about the GPHC standards. So this is a GPHC standards. Honestly, they love these sort of questions and never goes away. They've never been asked to recite them. To be honest, like in first year of pharmacy, they only ever got me to recite them in an exam, and that was in pharmacy school. So they would never ask you to recite them. They want you to be able to have applied them essentially. So they won't actually like ever specifically say like when did you show that you could do confidentiality or whatever, because like you wouldn't be expected to. So they go for the generic ones, like when was the time that you have demonstrated leadership? When have you, instead of patient-centered care, they'll be like, when have you put your someone's needs above yours? When have you worked well as a team? Give me an example of a time where you communicated effectively. This is the time where you kind of whip out, kind of think back to your personal statement. So with all your why pharmacy stuff, if that's basically question 1 of your personal statement, you can kind of regurgitate that. With the GPHC standards one, essentially it's question 3 of your personal statement, where you kind of applied all your experience and narrowed it off of why that experience made you good for pharmacy. So kind of like show off. So if you know that you communicated well because you are head of like the football team, then say that. So don't do generic ones, do ones that make you stand out. Like for example, myself, when I was your age, I volunteered for Childline, so as a Childline call handler. So I just, any chance I got, I knew that set me apart, so I just kept on saying it. So you just want to be a bit memorable. So the way that you answer these questions is using the STAR method. Set the scene. So say the situation that you did. So if you said like, whenever you had to raise concerns, so has someone in your class been nasty to someone else? Set the scene. What happened? Why were you involved? Who was involved? What was the task? So what were you trying to achieve, and what was your responsibility? So if you were trying to raise concerns and speak up for your classmate, say like, well, why? Because they were my friend, or I believe that they were being that was not right. So you kind of put a bit more background. So what did you do? Did you tell the teacher? Did you speak up? And then what was the result? So that's kind of how you kind of link the GPHC exam questions. So I've got like a few common ones that you can kind of look at. So they could say, tell me about a time you put someone else's needs first. So patient-centered care. Situation, while working part-time in a retail role, I noticed a customer struggling to understand instructions for a product they needed urgently. So my responsibility was to ensure they felt supported, understood what they were using. So essentially what I did was I slowed the conversation down, avoided jargon, asked open questions, and checked their understanding before they left. To spice it up a bit, you can even say like I worded things in layman's terms. So really get your buzzwords in. It's kind of like your personal statement, but like you're verbalizing it. And then your result. So like talk about what was like the achievement that you gained from doing that. Another one is describe a time when you worked in a team. So like the common ones like this. So these are the ones that I answered. I made sure to answer the generic ones so you guys could see how they could be answered. But yeah, just make sure that you answer these. I think certain universities as well really, really like questions like this. Like for example, Leicester. I'm trying to think as well. Kiel really likes them. I'm trying to think what else. Liverpool. So yeah, I've got a whole like I don't know if you guys are part of the group chat, but I kind of make a list of everything that's said in the group chat and I kind of have it on a piece of paper. So I try and like make note of it. Do you have to memorize a Y pharmacy answer? Sorry, I'm on a different tab, so I can't see your questions. So you don't need to memorize a Y pharmacy answer. Don't sound robotic. I always say just make prompts of your personal statement, like on a flashcard, like your key points. Like I know this is really silly, but when I do mock MMI interviews with like you guys, I always like they always like give you the question and they give you like 2 minutes to prepare. Never ever, no matter what, answer the question straight away. Always use those 2 minutes, even though it's the most basic question. Even with me, when I did my interview, I made them repeat the question so I had extra time because I always think like you could go blank. So in that time, essentially bullet point what you think you're going to say. So don't ever memorize, but have prompts and bullet points. I think, yeah, I think like speak the way that you would speak like you are at work or at work experience. So not formally, but not conversationally, like very you don't have to be like, oh well, I went to this and this like that. Just speak the way that you would speak if you were at school or speaking to a teacher or speaking to an adult. That's the best way I'd say. So a pharmacy MMI, what normally works is they'll give you essentially different stations. Typically, it's normally like a personality station, Y pharmacy. They'll give you an ethical scenario station. They'll give you a maths scenario station. They'll give you different stations, and you'll work around them. And then they kind of give you a score, and then those with the highest score, they may have a threshold or cut off will get an offer. We're gonna get to ethical scenarios. I think that's a good question. I'll give you a few now. Shall I write them in the chat? So actually, take note of these. Buzzwords would probably be patient-centered care, multidisciplinary team, empathy, any of the GPHC 9 standards. Try and get those things in, like confidentiality, and like raising concerns, because they'll listen to those. What else is there? Safeguarding, Gillick competency, active listening, layman terms, patient counselling as well, if you get a scenario like that, critical thinking. So really not like words that you kind of associate with the key roles of a pharmacist. Yeah, the sessions are being recorded now. I'm going to put it on my YouTube channel. So yeah, I'll put the link in after the session. Okay, so we'll move on. So yeah, let's talk about the role of the pharmacist, because every single answer of yours, the buzzwords that we talked about, need to essentially be linked to a pharmacist role. So I know it's changing a lot, but like people have misconceptions of what pharmacists actually do. So obviously we check prescriptions, we ensure medications are appropriate for the patient, we advise patients on how they take medications correctly. When we say advise how to take medications correctly, the buzzword is we do patient counselling. We counsel the patient. Prevent and manage side effects and interactions. We call that screening the prescription. You don't have to say that. It's a bit fancy, but that's what it's called. We support long-term conditions and we promote public health like vaccination, smoking and cessation. So key qualities. This is the things that you need to link your answer to. So you're patient-centered. Pharmacists are a good communicator. You may even get a question like, what are the key qualities do you think are important for a pharmacist to have? So these are the ones that they're going to be looking for. Professional, they're ethical, they're open-minded, they have attention to detail. So like if you're doing, let's say if you haven't done much experience, but you've got experience from doing lab practicals at like at college or sixth form, you can even say, oh, I've got attention to detail because I did lab practicals and had to make sure that they were accurate. And I was also making sure that they were accurate through doing means and calculations and stuff like that, and having to double check them. So you've got attention to detail there. You're a team player. You need to kind of essentially know when they'd be a team player as well. So like, pharmacists need to be a team player because they work in a multidisciplinary team or they work in a dispensary team. So there's things like that you need to know. And then, so good judgment, because obviously we are very responsible in terms of ethics and things like that. So we need to have good judgment when giving people medication. We have to have empathy, obviously, and then lifelong learning, because obviously medications change all the time. The guidelines change all the time. So we have to kind of keep up with that. And if you didn't know this, but we do something called CPD as pharmacists. And essentially you have to do that every year. So CPD is a process where you have to learn something new, and then you have to kind of write about it and send it to your registration, and then it proves that you're actually keeping on track of learning. So those are the things that they kind of like keeping an eye out for. So this is one of the things that I normally get, like with my mock interviews. One of the questions I ask is, tell me a bit about pharmacy first. And I think this is a really big misconception between prescribing and pharmacy first. So how many of you thought that pharmacy first is where we write prescriptions for the patient? You can put your hand up. I kind of want to see. Okay. It's fine if you did think, it makes sense if you did. It's actually not. So when you guys say pharmacy first is when pharmacists prescribe antibiotics for patients, you're wrong. So don't say that. It's basically essentially, you've got prescribing, obviously. Pharmacists can prescribe the way that GPs do. You have like a prescription, we write on the prescription. That is prescribing. Pharmacy first is a bit different. You don't need to understand the logistics of it, but it's the fact that essentially it's kind of like a flow chart. The government made a pre-made flow chart of like a tick box, basically, of if someone comes in with a sore throat, then you have a look at this checklist, and we check off the checklist. And if all the boxes are essentially ticked, then a prescription will be printed out. So we're not really using any clinical knowledge we're not really prescribing. It's just a checklist, and then the prescription will come out. That is essentially what pharmacy first is. We're not prescribing anything. It's kind of like a pre-made consultation that is ready for us. We just have to kind of like look at the checklist and make things make sense. Does that make sense, everyone? Yeah, cool. So it's not really prescribing, it's just pre-made. You don't need to know the logistics, but just be careful when you're saying what pharmacy first is. It's not prescribing. It's when it's just maybe word it as pharmacy first is a service where pharmacists can deliver or have the opportunity to give antibiotics to patients with minor ailments. Minor ailments means like minor conditions. So that's kind of the difference. With the prescribing course, they may ask you what your opinion is of it. When you ask your opinion, weigh your pros and cons, so say the benefits and negatives, and then give your opinion. Just don't say like, I think it's good, and here's why. Say both, because then you've got critical thinking as well. Obviously generic ones include like you can get burnt out, you're adding value, but we're not really gaining anything back. There could be an increase in, if more people are prescribing antibiotics, there's more antibiotic resistance. You can talk about that. So talk about the negatives as well as the pros as well. So that's the real difference. They just make sure you read up on pharmacy first though, and like what are the common conditions that they ask and stuff. So I know that certain universities like Lincoln, oh, can you repeat that, Sue? It's not really like you just tick things off. If you want me to get like, it gets a bit complicated, but essentially we don't have a prescription. It's called something called a patient group direction. If I actually, let me show you guys it. So throw, PGD. Okay, this is what pharmacy first looks at. So if you have a sore throat and you come into the pharmacy, this is what the pharmacist will then pull up, and it's basically looks like this. It will tell us everything that we need, everything who's included in the who can have essentially the antibiotics via the service, who can't. So you have to check through all of these if you don't have any of these. Cautions, if you're on any specific like meds, we have to look at the medication, how to cancel it. Like as if you're a prescriber, you can basically tailor the medication you pick based on the patient. But look here, they've only really given us like one medication that we can pick, right? And an alternative if you have a penicillin allergy. So everything's really done for you. Whereas prescribing, you don't have this. You have to come to this conclusion yourself. That's the difference. So once you've gone through the PGD and you made sure the patient fits all the criteria and is okay, then you log it in the computer and then the prescription will come out. Whereas in your prescribing, you won't have this in front of you. You have to ask the questions yourself and know all the knowledge yourself, and then prescribe separately on a paper within your own knowledge. Yeah. Does that make a bit better sense? Yeah. So that's what it's called. It's called a PGD. That's why I don't want to go into it because it's too complicated, but it's like a pre-made checklist. So just be careful with what you're saying. It's not really prescribing. It's just like pre-made. So Lincoln and Sheffield and a few other unis normally give you an article. So has anyone had to deal with an article here? Or been given an article? Okay, so you may get an article because some unis like it. They may ask you about give you a common one from like the BBC or like the NICE guidelines. You need to just be prepared for it. It may even come in an MMI station. So if you have a multiple mini interview situation going on, they could put an article on the table and ask you questions about it. So just be prepared for it. So how do you tackle an article? You need to identify the main issue. Like, why did they give you this? They gave you for a reason. There's an issue. Who is affected? Say the patient's NHS or pharmacists. Consider the benefits and risks. So a common one that I saw that was given was about weight loss jabs, right? So the issue was obviously weight loss jabs being given to like richer people instead of poor because they didn't have really access to it. So it affects patients as well as the NHS. Benefits and risks, obviously, it's important to obviously have weight loss jabs to specific people who need it instead of getting it available to everyone. Link it to the pharmacist role. So maybe the pharmacist has to ask more questions because people are getting weight loss jabs online. So the pharmacist can't really see if they're on it. So you have to ask more questions. It makes us have more work because maybe a patient may come in and have an allergy to something, or it may interrupt with that medication. So we have to be careful. We may have to look for more flags as well and be more knowledgeable of what's coming up. And then you just have to reflect on patient safety. I'll get on to maths in a sec because I've put a few maths questions for you guys to have a go up, and then we'll move on. So yeah, group interviews. I think a few universities do group interviews. Wolverhampton's known to do a group interview. Group interviews, I hate them, but it just happens. And the thing is, you can't keep quiet. Make sure you listen first. You don't want to be like very overbearing because they're always watching, really. Make sure you listen first, understand the task, contribute clearly without dominating. So what I normally do is kind of be like the second person. Let the first person speak, understand what they're saying, and a lot of the time you may have to play devil's advocate, but it's just more the fact that you get the conversation flowing. And if you do, then that's good because they get to the fact that you get to a different perspective. Kingston don't. I think let me see, who does group interviews? Check. Leicester and Wolverhampton. That's what I've been told so far. Yeah, there'll be a recording. So yeah, make sure you stay professional and focused. Just try and get a few words in. From what I've gathered when I've looked at MMI mocks, we normally look at those who don't speak as much, or don't deliver much to the conversation. So try and be like proactive. That's the best word to group interviews. Okay, wider reading. It's always good to kind of have an article up your sleeve about something that you read. I always say have, because they could ask you, like, have you read something in the news recently? I was asked that, and I was lucky because it was COVID, but you always have to have something up your sleeve. You could have something about, just be prepared for a group interview, because sometimes they do change it up. Because like I know that sometimes they switch the questions up, sometimes every now and then. Even after Christmas, they could switch the way that the interviews are done, because I think people talk to each other and they have to make it fair. So just read the interview email that they sent you really, really well as well, that, especially for Aston, because they kind of can give you clues to what's being asked. So just make sure. Yeah, it's fine. Just like make sure you just read the email. And if you are, well, you've come today, so you may be a bit more prepared, so it's fine. Wider reading. You guys ask me all the time, like, where do you get wider reading sources from? So there's a website called CPPE. You can get it from. The best ones I probably say are the BMJ, but it's more medical based. But if you want to go very pharmaceutic, like more pharmacy based, I'd probably go for the Pharmaceutical Journal. You have to pay. I think you get 3 things for free, but the free one is Chemist and Druggist. So maybe look at Chemist and Druggist and Pharmacy Magazine, and if you read about them, that's fine. But then maybe even look at like today's news. They could ask generically, like at the moment, the flu is a problem, right? Let's talk about flu jabs. Like, is there loads of flu jabs going on? So been talk about wearing masks. So talk about like current issues. Weight loss jabs is still a problem. So you can talk about that. Online pharmacies are still a problem. So just do generic wider reading, like you know what's like in the news, you just need to know a bit more about it. In terms of wider reading, again, when you look at the article, talk about like what I talked about, what you need to look for in terms of the article, like who does it affect, how does it affect the role of the pharmacist, maybe throw in a key stat in. But those are the things that they could ask you about. Okay, so ethical scenarios. Okay, let's talk about ethical scenarios, because you guys hate these. So I don't know if you guys have come from like my TikTok essentially, but on my TikTok, like last year, I put like a bunch of ethical scenarios on there and how to go through them. So you can watch them, they can also help. But in terms of like how to tackle them, right? Keywords with ethical scenarios. They could ask you generic ones, they could ask you fancy ones. A lot of the time, they do like a child-based one. So you need to know keywords like safeguarding, confidentiality, and Gillick competence. Someone used safeguarding in the wrong manner the other day in their mock interview. Just make sure you know what you're saying. Safeguarding is important, obviously, when a child's at harm. But that's a very trivial one, so they won't go towards that. They're normally going to ask you about confidentiality. Whereas pharmacists ask a patient and to be confidential, and how to make it confidential is when we're talking to them and we say, do you want to go into the consultation room? So if you want to say, like, if they said like maybe give, how would you approach a patient if they were upset about this issue? You could say, I'll talk to them privately in the on the consultation room. Gillick competence, it's not far from medicine, but obviously they could ask you about the morning after pill. So, but these are really, really tricky ones that they wouldn't really ask you a scenario about, but it's good to be aware. So I've put like really common ones because I know people have told me like what could come up, but this is one of the common ones. So you're scheduled to start work, but your car breaks down on the way and you realize you'll be late. How would you handle this situation? So I'm going to give you guys like 2 minutes. I want to see who would come up closest to the answer and how would you approach it. So maybe write your, like, what would be your 4-step plan if you had to be scheduled for work? and you were late. That's a good one. Anyone else? Come on, it's like kind of good practice. Yeah, that's good. They could even ask you this in a different way. They could even ask you like, you're late to play, you're a pharmacy student and you're late to placement because your train's been delayed. How would you handle this situation? So they ask this question, but in different fonts, basically. Yeah, that's good. Well done. Well done, guys. Really good. Um, so yeah, that is kind of what I would do with it. So I've kind of got like a 6-step process. So I would, one, communicate early, contact the workplace as soon as possible. So be honest and clear about the situation. Happened to be personally, I was a locum dispenser. I was literally like, my shift was at 9 and I knew the train got delayed at 8. So just ring them as soon as you can. Take responsibility, apologize for being late or you're going to be late, avoid excuses. So just kind of like the whole thing that the customer's correct, don't just apologize type of thing. Think about the impact. So acknowledge how lateness could affect the patients or the team. So if I come to the pharmacy, it's more of an issue if you're a responsible pharmacist, because if you're a responsible pharmacist and you're late, you can't open the pharmacy or anything. So you should acknowledge that. So kind of say, oh, I'm so sorry, I'm aware this is going to affect this. Maybe give a solution to what they can do as well, because that's being practical is the best way that you can help them. So yeah, offer them solutions and reflect professionally. Say maybe next time I'll do this, or how could you reduce this risk in the future? I know in real life you probably won't do this, but again, it's interviews to kind of like be kind of regimented in what you say. But as long as you offer solution, that's really good. So yeah, that's another common one they could ask. Another common one is, they love this one. You are working on a group presentation and notice that one group member is not contributing. How would you handle this situation? So they really, really like this one. So how would you guys kind of approach this one? Should we just go through it? It's fine. These are common ones. It's fine. I'm not too stressed. So just communicate, speak to the group member privately. That's really important. You need to say that you're going to do it privately, because then you're not confronting. A lot of the time as well, justify why as well. They really like that. So if you can say, I'm speaking to the group member privately, say, because I want to avoid confrontation and I don't want to make them feel worse than they already are. Ask if they're struggling and need support, because you may think that they have something going on. Avoid blaming and encourage an open discussions, kind of like, would you want me to speak to the team type of thing. Focus on the team's success, so you may have to redistribute. I think redistribution is really good. Do not take the workload yourself. Kind of ask them, can I bring it to the team? Because it's not your job alone. You're not really the leader of a group. It's a group presentation. So just make sure you say like, oh, we would redistribute based on like the person needing support. And then escalate if you need. Sometimes they could ask you, someone's got something going on at home, or it could just be someone who's not cooperative. If they're not cooperative, then you need to kind of put an escalation measure in place, essentially, and say, yeah, you've got a really, really good answer, Sharon. I really like that. Well done. So reflect professionally as well. So always reflect. They really, really love reflections. Honestly, you'll get sick and tired of them. But yeah, even saying it, like if you don't know how to reflect, you say, I would then after this process, I will reflect on the situation and how we could have worked better as a team or made this a more smoother process. So even saying it could help. Okay, we'll go through this one quickly because of time. So this is more of a less of a generic one, more of a pharmacy one. So a patient refuses to take their medication because they're experiencing side effects. What should a pharmacist do? Well, obviously you're not going to know what to do. You could probably say, if I didn't know what to do, I'd say I'd probably speak to them privately in the consultation room. I'd ask them questions. Why? Open questions. Do not say closed questions. Say, I want to ask them open questions to actually know what the exact issue is. You could say to them, I'd try to understand what sort of side effects they have, how long they're experiencing this for, what made them like completely no, like not against it. Did they read anything online that made them feel scared? And then just discuss this with them. So listen and acknowledge is really important. Obviously, check the severity of the side effects. So how long they've been having this for. Provide clear information. So kind of reason with them. Educate them on maybe some language on like why this, if it's a common side effect or a bad one, and what you can do about it. Obviously, say buzzwords. Obviously, put patient-centered care first. Make the patient feel really answered and that they feel comfortable. And if they need support, then you can always signpost, which we always say is like, if they need more help, they can always come back, or you can offer to talk to the GP who actually prescribed the medication so they could get an alternative. So those are the things that really generic things that you can put together for pharmacy-based ones. As long as you kind of put in patient-centered care, you're asking questions and you're escalating where appropriate and offering support and being really kind of light-hearted. That's kind of what you need to do when approaching these tricky pharmacy scenarios. Okay, so how to approach them overall. Stay calm, think logically, prioritize patient safety, always include that. Gather relevant information. So these are for the pharmacy-based ones. Act within your scope of practice. So you can't just like change the medication yourself. You're obviously not a doctor. Follow the guidance and escalate concerns and reflect your decisions. Always reflect. So what they're looking for. You're not going to get the right answer. You're not a pharmacist, and I'm not expected to get the right answer either until I qualify. They say this to us now. As long as you have professional judgment, you don't say things completely wrong. Like, I don't say I'd ignore them because they don't know what they're on about. Like, just all you could do is ask questions and try to gain a bit more of a better idea. Be clear in communication, willing to ask. Sometimes as well, like you can even say things like this: I'd use my professional judgment, try to think critically. So even things like learn how to like waffle if you need to, if you're really stuck. And that's just me being practical, and because I'd rather you waffle and say the right words than you saying I don't know. It's better than saying that. Okay, right. So in terms of more questions, I have questions on my website. So if you scan the QR code, essentially, I've got sample interview questions. I don't know if you've tried them. I'm going to try and get some sample ethical questions. It's a good idea. So I'll put a bunch of ethical ones on. So if you stay, I could probably do that tomorrow. So I'll put them on this weekend for you guys to try just ethical ones. And then I've also just uploaded maths ones. So you can have a go at some maths ones, essentially, to have a go at. So those are some sample ones that are free on the website. Okay, let's do some maths. Who here is nervous about maths? Raise your hand. Okay, fair enough. Yeah, don't be too stressed. They're not going to ask you anything that you're not supposed to know. Sometimes they don't even expect you to know A level. We haven't even finished. I always say try and keep in the frame of mind of GCSE maths or GCSE chemistry, because even in GCSE chemistry you did N equals M over MR, and you know how to convert from centimeters to milligrams. It's just going to be basic GCSE maths, nothing too hard really. And if it is hard, you should have the tools already to get there. They won't ask you something you don't already know, because that's not fair. So let's do a bit of practice questions. So a patient is prescribed 200 milligrams of a medicine. Each tablet contains 100 milligram. How many tablets are needed? So obviously, it depends on the interview. Sometimes they allow you to have a calculator, sometimes they don't. They'll tell you before. Yeah, cool. 2 tablets. Yeah, easy. Obviously, this is a bit easier. The ones that I've got, I'll put up harder ones. So a child needs 10 ml of cough syrup twice a day. How much cough syrup is needed in one day? Yeah, 20. Easy. I know these are really easy, but they try and like overshadow like ones that you kind of like need. So in the real thing, they won't give you the N equals MMR, but I just thought it would be easy for you to do it. So a drug has a molar mass of 200 grams per mole. How many moles are in 4 grams of this drug? Yeah, so you put essentially your mass on the top, divide it by your MR. So you do 4 divided by 200. You should get 0.02. Yeah, well done, guys. So those are the things that they kind of get you to do. Another one. So again, you'll probably be expected to know these equations, but a solution contains 0.5 moles of a drug in 250 ml of solution. What is the concentration in moles per decimeters cubed? That's not fair. I should change that to centimeters cubed. It's fine. Let's just do 0.5 divided by 250. So yeah, it should be that. My mistake, guys. So just put your N 0.5. We change the 250 to centimeters cubed, right? So that's divided by 1,000. That should be 0.02, 0.25. So let me actually write that on. Let's change that to 250. Oh, it'd be great if I had a pen. 250 centimeters cubed. Change that to that instead. So to go from centimeters cubed to decimeters cubed, I would go from, you have to basically divide by 1,000. So you do 250 divided by 1,000 to find out that you've got 0.25 decimeters cubed. Oh, dm, and then obviously you can just divide it then. So you could do 0.5 divided by 0.25, and you should get the answer, right? So yeah, 2. You with me? No, that was my fault. They wouldn't ask mil, so it's more of like a centimeters to decimeters. So you know the way that you'd get in chem, right? Because there's 2 things, they wouldn't do more than that. Yeah, okay. Sorry, guys. Okay, right. I've got like 10 other sample questions. Just go on the website and you can have a go at them. You guys have got me on Instagram. So if you guys want more questions, DM me and I can put some more up on there, because I essentially kind of just use a mix of first year ones. So I can use them and put a bank up with the bit of A-level ones. Would that be helpful? Okay, right. So, right, what do you need to do now? So we're going to finish it off. I know a lot of you have got like your interviews soon. You need to kind of decipher what, if you still feel you need to decipher if that what the issue is now. You need to decipher if there's a knowledge issue, like you don't feel confident in the knowledge that has been given today, or some of the knowledge that you may need. or you need to make sure that are you nervous about the situation? Like, are you nervous about the interview? Because I always say divide the two. If you're nervous about the knowledge, go down the flashcard route, do some reading, drop me a message. I can see if I can help you. There's things on there. I'll try and update the website through as much as I can. With knowledge as well, I do have an interview course, but I can try and put these slides up as well for you. And if you have an issue with actual interviews, I say this for everyone, just make sure you do a mock interview. If you're more nervous than most, do a mock interview with every single person in your family. Just give them the questions off the bat, or you essentially, like, if you want it a bit more startled, just make a document of questions, or give them the questions I have and set time to pick random ones off the list so you don't anticipate them. And just practice with them, because you need to make sure you feel the stress in the environment. And normally do that 2 to 3 days before, because you don't want to do it the day before, because there's nothing you can do about it. If you do the mock interview and you do really badly, what are you supposed to do about it if you do it the day before? So do it 2 to 3 days before, with someone that you know, as much as you can. Process the information and revise it. So I used to take flashcards with me with all the key stuff. So the GPHC standards, examples of how I met the standards. I even printed off my personal statement and highlighted all my experiences and tried to link that to a standard. Make sure to utilize the preparation time in the interview. Use the 2 minutes that they give you, or 3 minutes, no matter what, if you know the answer. Because what I do is you bullet point your answer. So even if it's the ethical situation, or even if it's why pharmacy, bullet point basically what you're going to say. Because if you go blank, you're not going to know where you was left off. Because what I normally do is I would speak. If I went blank, I would look down at the bullet point I knew or thought I was back at and just carried on. So really make sure you're bullet pointing. You can do that and utilizing the time. Okay, right. Thank you for listening. If you guys got any questions, and in terms of interview resources, I try to be a bit more fair because I put more like free stuff on the website, but there is obviously like paid stuff because I've got like an online course that is a pure dummies guide, the online courses. You do that if like you have no clue where to start. It kind of babies you a bit, so a lot of the time I know students kind of skip through the first part. I just have model answers as well, so you can do just the model answers. So it's like 50 plus questions with the model answers. You can look at how those are answers, or if you don't have anyone to do it, you can book an MMI interview with me and I can tailor it to the website. But obviously with your discretion, it's kind of what you need. So I'm gonna ask you guys, have you got any questions that you want to ask me, or is there anything that you would want help on, or essentially I can put on the website that you'd find useful? And with the recording, I will put it up on my YouTube. So just type in Pharmaspire on YouTube and it should be there. So the pharmacy job as a whole is a good work-life balance. Like you compared to medicine, it's like you as a doctor you work 48 hours. With pharmacy you work 37 and a half a week. It's like a standard full-time job. You get everything you want. You can work part-time, you can even locum. So yeah, good work-life balance. When it comes to the course is intense. It's truly whether or not like you're good at revising. You just have to be good at retaining information, and practice that with that early. So with the course, it's really hard to gain a work-life balance, but after that, in the actual role, it's generally a good work-life balance job. That's why I kind of picked pharmacy. I don't have the UCL test prep because I know that they're a bit weird about releasing stuff. But if you go on TikTok, there is a girl called Reem, and I think she's posted a video on it. And UCL do some videos. I think they've released some videos lately on how to help students. No, chemistry questions are not difficult. When I did my pharmacy interview, they literally was like, what is the name of the compound AlCl3? And I was like, aluminium chloride, and they were like, yeah. So like it's not hard. It's very like I'd probably say the furthest it'd go is kind of module 2 AS. It's probably the furthest it'll go was probably AS. Obviously the IB course is still a lot of chatter about it. There's nothing really currently happening. When we think about pharmacy in general, it's more to do with like the medications that are coming out and what's being approved. So in terms of that, you can find things that are being released. If you look at Pharmaceutical Journal, the BMJ is really good, and then big stuff would be on BBC News. I'm not sure. I think Kingston's is a 3-hour interview. So when I did it, I was just asked a load of questions and like given a mini, like I think they may give you a mini maths test, but don't be too stressed about that. They're just very strict. Don't be discouraged. You have to think like the UCAS deadline hasn't even approached yet. So don't be stressed. They do take ages to get back. It depends on the university. For group. Are you on about Kingston, Sarah? From what I remember for Kingston, I think it's 1-to-1. Group interviews are normally Kiel and no, Leicester and Wolverhampton. That's what Wolverhampton's very big on group interviews. I know, 3 hours. Oh, it depends on the university. Most universities are 1-to-1. I think Wolverhampton and Leicester do a bit of a group segment. Okay. If you guys need anything else, just drop me a DM on Instagram. I'll get back to you as much as you can. And I'll post this and yeah, drop me a message or anything. And if you need any more resources or you think that it may be helpful for someone else, just drop me a message because I'll try and get that on the next day. I'll try and put some more ethical scenario questions and I can try and make another maths one as well. But good luck and do not hesitate to like drop me a message because I want to know how you guys go. Do you mean like a video call with what? Me? Would you want one? Because I'm recording this and it will go on YouTube and I don't think anyone else would want to go to another one. Like what things would you want covered? Should I do like a specific ethical scenario one or a specific maths one? Like a maths interview one, like a separate one? Okay. I could do like let's like okay, this is like a hot like this is supposed to be a general one, but maybe if we could do like an ethics one, just an hour of ethics questions and how to do them. We could do that. Again, if they ask about AI, talk about the pros, the cons of AI, and then just give your opinion. So I do online MMIs, but it's a bit difficult for me because I'm alone. So if I did one as a group, is a bit different. I do like individual ones, but obviously I can't like it's facilities that make it hard because I have to put you in breakout rooms and stuff like that. And I don't know how it works with all of us talking. Good ideas. Keep giving me them. You guys can be like my guinea pigs. I'll start the recording right now.